So what we understand about psychology, what we understand about how the body works, completely ignores women's hormones.
Hi there, and welcome to Am I Crazy Or? The podcast where I, Lisa Påske, businesswoman, entrepreneur, and general troublemaker, take on all the ways that society gaslight us into thinking we are going crazy. This season, we are tackling the perimenopause. They often call it the second spring. I think it should be called monsoon season. But I'm not doing any of this alone. In each episode, I'll be interviewing and talking to experts, specialists, and women going through it, giving you all the information that you need to make more sense of this chaotic period of your life. This week, I had the pleasure of interviewing Adele Wimsatt. Now, Adele is a women health practitioner and a cyclical living guide, and she specializes in helping women with their hormones. When I first came across Adele was because of all her work helping people understand the impact of perimenopause and ADHD. Now, I only realized I had ADHD when I went into perimenopause, and we're going to be talking about that today.
Hey.
How are you?
Yeah, good. Happy to be here.
I'm so happy to have you on this podcast because when I first realized I might be in perimenopause, I also had a suspicion I had ADHD. And as I was looking into all of this, my best friend actually said, you need to look at this woman, Adele's Instagram, Harmonize You. Mm-hmm. And as I started looking through your website, I was like, oh my God. Oh my God. There was so many things. I was like, oh, I really feel like it might be both of these. Mm-hmm. But first, can you tell me a little bit about you and your company and how you got there?
Sure. So I'm a women's health practitioner and I work with all women around their hormones. I'm an absolute hormone nerd, but my niche, absolute passion within that is around ADHD and perimenopause and really supporting women in that season because it's a really complex time. You know, so many of the women I work with say, what is this? Is this ADHD? Is it my hormones? Is it my childhood trauma? Is it? And it's just this mess. And because it's ADHD women, we're down the rabbit holes. We want to know everything. We need to understand why. We just go into this information paralysis. We've got all this information. It's like, I don't know what to do with it. So my job is hand it over to me. Let me unpick it all for you. And let's deal with your hormones. Because I believe passionately that when we address a woman's hormones, the majority of things can be sorted out. But we don't have a medical model that honours that. So this is where we're seeing a lot of problems. So my job is let's sort your hormones out. And I'm not just talking about our reproductive hormones like progesterone, estrogen. I'm looking at adrenal function. I'm looking at thyroid function. I'm looking at blood sugar regulation, gut health, liver detox, because all these things affect our hormones. And then we go, okay, what are we left with? What really might need medicating if that's a path you choose for ADHD? Let's not try and treat our hormonal imbalances with another form of medication. So that's my job. I support women to deal with menstrual cycle issues and hormone imbalances. And where it's ADHD women, I do that within a context of their ADHD to understand the role their hormones are playing on their traits.
Yeah. And so so you have ADHD yourself?
I do. Yeah, I have combined type. I was diagnosed about 4 or 5 years ago now. And my previous life, I was actually a senior manager in youth justice services. So I was very familiar with ADHD in naughty boys, which is, you know, that very stereotypical way that we were all trained in understanding it. And I used to joke that, oh, that's my ADHD, but never really took it seriously. And then things started to come up around this and I was like, this is me. And I was like, what do I need a diagnosis for? I don't need a diagnosis. I've been successful, you know, whatever that really means. But for various reasons, I did seek a diagnosis. And for me personally, it was the most validating experience of my life. I just burst out crying, which wasn't expected because I had massive imposter syndrome. Even at the point, I was like, oh my gosh, if this isn't ADHD, I don't know what is wrong with me. And he was like, 100% in circles, severe ADHD. It's like, oh, okay. There's nothing wrong with me. My whole life kind of makes sense now. And since then, there's been this unraveling. And because I work in women's health, my go-to was, okay, where's the research? You know, how my hormones affecting my traits. And my not so inner feminist was raging at the fact there was nothing. Hormones affect everything. How can there be no research into hormones and ADHD. So I then embarked on a mission that I'm still on to expand the knowledge we have around this and fill this gap to empower neurodivergent women with understanding the massive link with their hormones.
Honestly, I get goosebumps on my face. It's so crazy. Like, I had no idea. One, I had no idea really. Like, I used to also joke I was ADHD, but it was almost like a tick that I did to kind of like excuse me being different.
Yeah.
I was like, I'll just use this one because I feel so different. I feel like I think so differently. But I was not prepared for how bad things would get as I came into perimenopause. Yeah. Can you tell me a little bit about what happens, why it's so difficult for women, particularly with ADHD, when they go into perimenopause?
Yeah, so we probably need to go back a little bit before perimenopause happens, just to explain that kind of journey. And we have one study really, which was in the Journal of Psychiatry in 2021, that showed women with ADHD are more likely to have a much more challenging perimenopause and other hormonal shifts, but we'll focus on peri today. So we've got a little bit of backup, this tiny little bit of validation there, and much more research needs to be done. But when we are menstruating, we have the hormones do this dance each month. So from our bleed, from around day 3, right up until ovulation, estrogen's on the rise if we are ovulating. So this doesn't apply if you're on a contraceptive. But if you're naturally ovulating, estrogen rises and rises. And I describe her as the sexy party girl. She's a bit like Beyonce. Okay, so she makes you feel really sociable, good cognition, energy, all these things. She sensitizes dopamine and serotonin. So this is really important for our neurodivergent brains that struggle with these neurotransmitters. So it sensitizes these neurotransmitters, which means a lot of our traits are much more manageable at this time. So women often go, oh, I'm all right, actually. All these strategies that we have that support us, they work. Now, the estrogen rises. We then ovulate, assuming we're not in perimenopause. So in our fertile years, we're likely to ovulate that month. And then we produce progesterone, but only if we've ovulated. So then we have this massive rise in progesterone in the second half of the cycle. And progesterone sensitizes a neurotransmitter called GABA, which is relaxing. So for many women, not all, but many women, progesterone is like Valium for the nervous system. Okay, our brain is covered in estrogen and progesterone receptors. And that means those cells depend on those hormones to do their jobs properly. So if they're not there and they're not in the right ratios, the brain is like, what's going on? Okay, so we need the cognitive function, the executive function, the mood imbalances, the sleep, all of these things depend on our hormones to sensitize the neurotransmitters as well. So why are we not talking about this in ADHD, right? So women are doing this dance each month, whether you're neurotypical or not, of the interplay of affecting every system in the body. The hormones are not just about your reproductive health. They're everywhere. They're your gut, your immune system, your skin elasticity, your body temperature, everything they're affecting. And the medical approach is so short-sighted with how we look at these hormones. So this is the dance in menstruation. And as you said, for many women who then hit perimenopause, which we know is happening a lot earlier, so, late 30s, early 40s, because of stress, which is another topic in itself, we don't ovulate so much. So we're not seeing this progesterone production. So estrogen starts to dominate, but estrogen might be in lower levels as well. That has this knock-on effect on the neurotransmitters, and all the lovely strategies that help us keep the lid on it, they're gone. The lid comes off and we're like, what fresh hell is this that we're in? God. And don't know what it is. And then we just don't know ourselves anymore. And yet the way we treat ADHD completely ignores hormones. How can you do that? They are fundamental to how a woman's brain copes with the ADHD. So does that help to explain that?
Yeah, absolutely. It is fascinating to me, like how it could have been ignored for so long. But I guess that's because it's so complicated and everyone's so different.
Yeah. So there is something called the gender bias in research. Okay. So medical research has been undertaken historically by men on men. Okay, so everything in the foundations of what we know about medicine comes from a very misogynistic perspective. Maybe not intentionally, but that is what we know to be true. So what we understand about psychology, what we understand about how the body works, completely ignores women's hormones. So 50% of the world's population are not considered in research, and it's starting to shift a little bit now, but we're expensive to research because our hormones fluctuate. So if women are included, they tend to shut their cycle down with a pill. So we still don't get this true picture of what women need. Even lab rats tend to be male. So when we're testing medication, they're still tested on a male physiology. And for example, we know women tend to have much more side effects to medications than men do. Yeah, have you ever been told that by a doctor? Look,
No.
It's just not there. We get treated as small men. And this is huge across the board in all aspects of health, not just ADHD, but it's stark in ADHD because so much of what we know to be true is based on naughty little white boys. And we are really, as women, are guinea pigs to a lot of these models. We know, for example, for some women, their medication doesn't work in the second half of their cycle because estrogen sensitizes it and progesterone makes it less effective. So when there's this dance, they think, my medication isn't working anymore.
Yes.
Because they don't understand, no one's teaching them and telling them.
Oh, I did the same thing as you. I went straight into the research, and the more I researched, the more terrified I got. What is this?
Yeah.
And also, I realized just so much of what happened the 4 years before could be explained, but they hadn't. I'd done so many medical procedures and tests and scans and operation.
Yeah.
In fact, I actually I went through the list of all the things through my NHS app, and then charted out all the things that I thought would very likely to be related to the perimenopause, like joint pains, frozen shoulder, UTI, low moods, fatigue, and all the blood tests and stuff. And it's like over 15 grand.
Do you know what? This is something that I'm a little bit on my soapbox about, quite a lot about on my soapbox about at the moment, is the approach to women around their hormones is so inadequate, I can't tell you, in the majority of situations. And one of those things is the cost on the NHS of not properly training doctors in women's hormones. They're not properly trained.
No.
Unless a doctor is taking it off their own back to go and pay for really good hormone training outside of standard training, they are not adequately equipped to deal with women's hormones. So we are having women with heart palpitations being sent to cardiology. Yeah. They might need estrogen. We are having women with aches and pains being sent to rheumatology. They might need estrogen. All of these things being sent, to looking at recurrent UTIs. What hormones does your body need? Mental health services. All of this being clogged up, even extending out to social services for women who just can't cope with things. And we're going, oh gosh, she's not a very good mother. My old head on in my previous career. Actually, maybe she needs a bit of support with her hormones. The impact on communities of women's hormones is huge, and it's never discussed.
No. It's like, and that's the thing, if it is discussed, it's almost like a joke to everyone. They're like, oh, she's on a period. Or she's in the menopause. And that is so damaging. No wonder no one's talking about it.
There's a real cultural aspect to it. And, there's a real spiritual aspect actually to the cyclical nature of women and to the different seasons, our different life seasons. But we're just not supported to adequately deal with it. And so women feel gaslit. They finally get the bravery to go to a GP and say, what's happening. They look at bloods. We'll look at your hormones. They're fine. Pointless. Do not have blood tests to look at your estrogen and progesterone levels. They're absolutely pointless because they change minute by minute. And the second at which you had that blood test done on that day, those blood results will be very accurate for that second. 5 minutes later, they'll look very different.
Wow.
Your hormones pulse. So they release hormones in surges. That is not a helpful reflection of what a woman's going through. So she goes with her experience and is told, no, you're normal. Okay, well, this doesn't feel very normal.
Yeah.
And you're just left. Or, the number of things I hear that women are told is just diabolical. And actually, we need to change the narrative around women's health. We need to better train doctors and medical professionals and prescribers to understand the impact hormones have on every aspect of women's health.
Yeah, absolutely. I did an interview with a menopause doctor a couple of weeks ago, and when we talked about the education of menopause when she was in medical school, it was 1 hour.
Yeah.
Which is shocking.
And you look at the impact it has on society. You know, even women who are at the peak of their careers with all their knowledge, their experience, and suddenly they're in a boardroom, probably full of men, and they can't remember what they were talking about. Yeah. That is going to massively affect your confidence, you know, and that can be an issue with ADHD anyway. Then you add in hormone deficiency and it's terrifying. So then we start developing this anxiety. The inner critic gets really loud, and we see women leaving. Yeah. This has an impact on community. You know, women not being seen in senior positions at that point because of it. You know, incomes being reduced from families because they can't sustain that position anymore. It's huge, the impact.
It's really interesting though, because if I think about it now, I think about how many women I know that changed careers in the mid-40s. I'm now thinking, hang on, was that because she wanted to? Because she felt she couldn't deal in where she was? Yeah. And I know myself that I had just sold my agency and I was 40 and then I had the earnout and I felt so like not myself. I couldn't think. I felt really stressed, and that kind of like I've always struggled with the hormones, especially just before my period, and feeling really dysregulated and getting quick to anger and getting upset, and that's a ADHD trait as well, right?
Exactly. So we again, that part of the cycle, so the menstrual cycle has 4 distinct phases, and the phase that you're speaking about there is called the luteal phase. It's the premenstrual phase. It's the phase most women go, I know that phase. I know where I'm in it. And usually when we see symptoms like that, again, we know it's more challenging for ADHD women this time. We see a big link with something called PMDD, which is severe PMT, but there's loads we can do about that. But what happens is usually with those kind of symptoms, it's progesterone deficiency again. And estrogen just has a party by herself. So we don't have the soothing effects of the progesterone on the nervous system present during that phase of our cycle. Our blood sugar becomes more dysregulated. Our cortisol levels are all over the place. We're probably not sleeping as well because of the lack of progesterone. And then our traits are over the place and we feel like we have PMT experiences.
I used to do this thing. This is now so telling, because I felt so bad about how reactive I would be just before my period. And I was managing an agency of like 60 people. And I felt so guilty for how I would be different in that leading up week. I used to have this Darth Vader stress ball that I used to put on my desk to warn people, this is not the week.
Yeah. But do you know what? I mean, as much as, you know, again, that's kind of almost that joke thing, isn't it? About actually what was a really tough period for you. And then we show up in a way that we don't maybe like about ourselves. And then we feel guilty. And then the inner critic gets loud. We may be talking to our children in a way we don't want to, or our partner, or all these things. And then we're like, I'm so sorry. Yeah. You know, coming back. But if we had a world that normalized the cyclical nature of women, I have a big red heart that goes on my fridge because that is my week where everyone's like, oh, Moe's in the danger zone. And it's just, I'm not going to be doing play dates, so don't ask me. Yeah. You know, everyone knows, oh, the heart's up. Yeah. That life's going to be a bit different. It's going to be gentler. I'm not going to be cooking like that week,
used a heart instead of Darth Vader.
I had to use a heart because otherwise it was like, remember, Mummy still loves you even if it doesn't sound like it.
That's lovely.
And it's, you know, we find these ways, if we normalise these conversations, women wouldn't work at the same level as they do during that phase, but we'd be on fire and rocket fueled. In the other phase, when that estrogen's high, we're in hyper focus, we're there, we're doing it. But we don't give ourselves the luxury of all of that because we're so burnt out from pushing through in these phases where the body is meant to slow down and rest. We used to be in red tents. You know, as a community, we'd all bleed at the same time before we had, you know, unnatural light. We would go in, women would usually be in sync, and we would rest, and then we would come out afterwards. That is what we are meant to do. I know.
That sounds so lovely, just being just with my friends.
I know. just laying under a blanket around a fire. Yeah, just stroke my hair.
Oh yeah, let's bring that back.
Yeah.
Like, imagine if that was a thing. Like, if you had like a special hotel where you could just go to.
Do you know what? I fantasize about these things so often. I actually, in October, did a pilot with a friend where we created something called the Bleeding Space, which was that where women just came in and they were just looked after. They just walked in, they got under a blanket, we did some Reiki, we did some meditation, but they just didn't have to do anything. They could drink cacao if they wanted to, they could just lay there and be, because that's what we're meant to do. And if we can honour that on some level, because most of us still have to work, most of us still have to have the relentless to-do list running around our mind, but all women can weave some slowness in. You know, even if it's, I'm sat in the car, normally I'd be really stressed, actually I'm going to do a bit of breath work. You know, actually I'm going to give myself permission to give the kids scrambled egg or beans for dinner. I'm not rustling anything else up. You know, just being a bit gentler with ourselves so we can fill our cup a bit during that time.
Yeah, I totally agree. I actually quite consciously now don't book any big meetings or important things in that week before. Like I can't do any podcast recordings because I'll be like,
No, so this is one of the things that I actually teach the women that I work with. There's a tool that I use to teach women to track their cycles against their hormonal fluctuations. And then what we do together after several months worth of data is we analyse that and create an ADHD-friendly lifestyle around their hormonal fluctuations. So we look at where are the hyperactive traits flaring up, where are the inattentive traits flaring up. And I'm actually leading on a study with a company called Mira at the moment where we're taking a small cohort of women
I just bought that one.
Oh, have you?
Yes.
It's amazing.
Is it?
So it's the best device, in my opinion, to track your exact estrogen and progesterone levels. And then I teach women to track their traits alongside that.
Yes.
Because someone tracking and going, oh, you know, I'm not getting this wave. It's like, well, you're probably not ovulating. You know, it's going to do the same thing all month, really. If you're not ovulating, there's not going to be a huge difference probably until right before your period. But the Mira device you can look at, you know, together. And I can get you 20% off if anyone wants one of those. But you can get that data and it's incredible. And that's what we're using in the study. The women are tracking, and then in 3 months' time, I will sit with each of them and we will analyse where their traits are in relation to their hormonal fluctuations. And that is so empowering for women.
And this is the weird thing. Like when I was in my 20s and 30s, I kind of knew that I had a period where I felt lower moods and whatever. But like now, after doing all this research about it, I'm like, we all should really know this and know which phase is because internalizing, like not just for women with ADHD, but anyone with the internalizing we do when our mood changes. It really contributes to internalizing thoughts about yourself being bad or angry or...
I think so much of the journey I go on with women that I work with is about the validation and the acknowledgement that this is happening. It's not in your head. This is how you feel. And suddenly you're like, oh my gosh, even what I want to wear changes and how I want to socialize and how sexy I feel. And all these things are different in different phases of your cycle. And no one's ever taught us. That makes me mad.
Yeah.
You know, like, why did no one sit down with me and tell me this is what I was going to do? The way that I show up is going to change. And that's okay.
Yeah.
That different times of your month, you need to rest more, you need to play more, you need to work harder, you need to change the type of exercise, the way that you eat, how you honor your sleep. If you can do that in sync with your cycle, you are going to not burn out. But no one teaches us that. We're told to go and go and go and go and go like men do. They're linear.
Yeah.
They don't cycle like this.
No.
You know, they burn out much slower than we do. It's not that they can't, but because we push through that phase where we're meant to be slowing down and resting, the workplace 9-to-5 model does not suit women.
No. Absolutely. So tell me a little bit about, so one of the things that I started talking to you about on Instagram was progesterone.
Yeah.
And I now realize that there's a lot of misconceptions with progesterone. And to be fair, like I do think that I do have a bit of intolerance for progesterone because when I was on the combined pill in my late 20s, I had a rash everywhere, like these big round rashes everywhere. And I had to go to the hospital and they said, don't take that pill. And they kind of made it sound like I was allergic to the brand or something, but no one talked to me about why. I kind of just put in my head, okay, I can't use that. So when I came into the clinic, the menopause clinic, to be able to get HRT, I was really scared of the progesterone.
Of course you are.
And so when I started taking progesterone, and I know that mostly progesterone you take by mouth, I did feel quite a strong kind of like lower mood and more like the eczema came back and so on. But tell me about progesterone, because you know so much about this.
Okay, I'm
what
an
is progesterone?
absolute progesterone nerd. Okay, this is my absolute hyper focus and something I've been obsessed with for several months. And I have had the privilege of interviewing the international lead on progesterone with decades of clinical trials. And these are free webinars on my website so that everyone can have this knowledge. And I actually feel like there is an international war on progesterone. This is a term I've heard used around this. So progesterone is only looked at medically to protect the lining of your uterus, okay? So estrogen gets all the spotlight when it comes to hormones. And estrogen is a proliferator. So estrogen builds the thickness of the lining of the walls, building up. And progesterone's job is to come in like the plasterer and say, stop now, and smooth it all out, okay, on a cyclical basis. Now, if there isn't enough progesterone, estrogen will just keep building. And we can see risks like endometrial cancers and fibroids, which is why I get very frustrated at this model of, I've still got symptoms, just up your estrogen. No, we can't do that. Estrogen needs to be kept in check by progesterone. And progesterone does so much more than protect the lining of the womb. The biggest thing for me is mood stabilization. A woman cannot stabilize her mood without progesterone. She's like a miracle molecule. She'll protect your breast health, grow your bones, your nerve health. She plays lots of roles in the body. And unfortunately, there is so much confusion around it. So as you've just said, I was put on the pill and I reacted to it. That is not progesterone. But you will be told medically, this is your progesterone. It's not progesterone. But the word gets used interchangeably. It's a synthetic progestin. And this is a really important thing that we need to address, because women are thinking they have reactions to progesterone, but it's not. They're synthetic progestins. And these came about in the 60s when pharmaceutical companies realized what amazing things progesterone did in terms of being able to prevent pregnancy. But you cannot patent a molecule that comes from nature. So what they did was change the molecule slightly in a lab, which created a whole host of side effects and risks, which is when we talk about HRT risks of breast cancer, it's synthetic progestins that are the link, not progesterones. So the synthetic progestin, exactly. So synthetic progestins are found in the pill, the implant, depot injections, the Mirena coil, patches. They have body identical estrogen, but synthetic progestins in them. But you will be told this is your progesterone, okay? And in my clinical experience, ADHD women tend to have much more sensitivity to synthetic progestins. Okay, but they go, I'm allergic to progesterone, I can't have it. Or I've got an insensitivity, whatever the language is. It's not progesterone. But you will be told, you don't need progesterone because you've got the implant, or you've got this, that's giving you progesterone. It's factually incorrect, and it is causing huge problems, this miscommunication. So that's the first bit I wanted to speak to around that. The second thing is body identical progesterone is so misunderstood and under-researched. And the current, if you look at the work of Dr. Katarina Dalton, Carol Peterson, Dr. Phyllis Bronson, she has an incredible book on Amazon all about mood and hormones. They use very, very, very high doses of progesterone, body identical progesterone, not synthetic progestins. And they have looked at treating PMDD, bipolar, schizophrenia, anxiety, depression, insomnia, all kinds of mood disorders in women. Now, there's a big industry out there that doesn't want women to be treated with a body identical progesterone, right? Because we like women being unwell and on medications. But we know this to be true. But unfortunately, you will not get anywhere near that dose through conventional routes. So the most you will probably get is about 100, 200. That's probably the most. Occasionally, you might be lucky enough to get 300. These practitioners start their women on 300 or 400, and they go up to like 2,500 in a 24-hour period. These are the protocols they've been using on women really successfully for decades with no side effects. Okay, we've known this for 75 years. We have known high doses of progesterone treat PMDD, whereas historically we thought that it causes it.
Yes.
So all this information is there, but it's not coming down to frontline practice. So that leaves women in a little bit of a tricky situation. So the specialist GP I run my clinic with and I are really working on this. I'm working closely with Carol Peterson. So we're bringing in the change, which is great. But it rattles cages, right? When we start to change the narrative, it feels uncomfortable to people. You know, it feels uncomfortable that there is this solution here. And body identical progesterone, when women say, oh, I react to that, when it is properly the progesterone, it's probably too low a dose. Okay. But true progesterone sensitivity is incredibly rare. There are many, many reasons that you cannot get on with it initially. And one of them is actually, the most common one is currently termed estrogen kickback. And that is you start taking the progesterone, it fires up the estrogen receptors and makes estrogen work better. Now, if your body has a lot of what we call xenoestrogens, which are environmental estrogens, so chemicals from plastics in our water, products that we use, it's going to fire that up in your body. That's not going to feel good. Or if you have a body that metabolizes estrogens into what I call estrogen gremlins, you're going to get a massive mood flare up because they're the things attached to your estrogen receptors. And you need to go back a step and work on the methylation pathways in the liver. And actually, sometimes it's that progesterone's going in and you just need to go harder and faster would be the advice of these women. Rather than this low, slow stop, it's not right. We've got it all wrong. And so, you know, this is a game changer for women's mental health. That if we get these doses right in women, you can change their life. And the things that the doctor and I are seeing with even women introducing over-the-counter progesterone creams, the differences in their luteal phase and their PMDD is phenomenal. They're like, why did I not know this? So there is
a cream?
You can get an over-the-counter progesterone cream you can buy online. They are much lower doses. In America, they can get really great high doses, which are wonderful, but over here we can't. They're much lower doses, but still they can be effective for women who perhaps aren't able to access private routes for these prescribing. I mean, I won't go on to the privilege that surrounds menopause. You know, if you've got money, you can have a wonderful menopause, but if you haven't, it can be quite tricky and quite traumatizing, actually.
Yeah.
So does that help explain about progesterone?
Totally. So I feel like I interrupted your flow. So basically, progesterone, the misunderstanding with progesterone and progestin is what has caused all this confusion about progesterone. Yeah. And also, I think one of the most common misconception, and I have said it myself, is progesterone gives you PMDD or PMS. That's the cause of it. Yeah. But that's not the case.
No, so this hasn't been researched, okay, in the level that we need it to be. Yeah. There's not enough there. And like anything, there's going to be various causes for different things. But the kind of theory that most people have, and understanding, this was my understanding as well, was that with PMDD, the brain becomes sensitive to hormonal fluctuations. So, for example, at a time you may have been ovulating and your progesterone was high. So the environment of the body was high progesterone. A traumatic event may have occurred in your life. And therefore the brain recognizes, okay, these are the conditions when something really bad happened, and it kind of dysregulates it. So that's been one theory around PMDD. Another has been around a metabolite of progesterone called allopregnanolone and how this interacts with the receptors. So allopregnanolone has a little bit of like a benzo type effect. It can be very calming and sedating. It's why oral progesterone is great for sleep, because it has this really calming effect on the nervous system for most women. So it's thought that there's an issue in an individual woman's body with that particular metabolite. But the bottom line is most research is funded by pharmaceutical companies. So we don't get the data that we really need because the investment is not being made in researching women. So we have a lot of theories.
I see. And so to be able to take progesterone, what are the options for women, like in the UK, for example, or is it the same most places?
Very limited is the honest answer. I mean, I know some women, get it imported from other countries. That's how desperate women are getting to get hold of this, because what's happening is this information is slowly filtering down, and it's women leading on this. It's not coming from medical professionals and protocol providers. It is coming from women doing their own research, listening to resources like this, going, wait a minute, I want this. And then maybe finding ways that they are experiencing getting the progesterone that they want, and then go, oh my gosh, this works for me, how do I get it? And they're being told, I'm not prescribing that. I'm not giving that to you because it doesn't fit neatly in this little rule book, which treats women as robots. You need to tick this before I give you this. And then when you give that, I will give you that. Women are unique bio-individual creatures that need a very bespoke, tailored response to their unique physiology. And that is not how the current system works. And there is fear. There is so much fear around prescribing, which I really understand. You know, recently we've seen one woman completely demonized. And I would say this has put our HRT prescribing back at least 5 years. It's been a massively detrimental impact for women who are trying to access HRT. So the routes are: go to the NHS provider, try and find someone who will really hear you in your experience. You can download a free menopause tracker from my website. So you're going like, these are my symptoms, this is what's going on. And ask to start trying some body identical progesterone. It will usually be oral. If you take it vaginally, it doesn't tend to have the same impact on mood and sleep. So taking it orally, but they're your two options. If you go down a private route, which obviously comes with a cost, you have a huge array of options available to you. We can get sublingual lozenges, we can get pessaries, we can get creams, all made up to prescription dose and to quite high doses if that is deemed what that individual woman needs following consultation.
So it's not just, because the most common progesterone to be prescribed is utrogestin.
It's a horrible word, isn't it? I can never spell it properly.
And is that and that you can take orally or vaginally?
No, you can do. Most women tend to take it orally.
But is there no other progesterone alternative to utrogestin in the UK? Or
there is. You can get. There's a new company. It's a company that women are starting to be prescribed instead of utrogestin. And from what I'm observing, it's coming from the EU and women are not responding to it generally. The name of it begins with G. I can't remember. It's a G and an X in the name.
Okay.
I can't pull the name through.
Yeah, that's okay.
But women, from what I'm seeing, are not responding as well to it as the utrogestin, but they're being told it's the same thing. Particularly if women have already been on the utrogestin and then they're suddenly prescribed this. Women are noticing that difference. You go straight back into progesterone deficient state, symptoms come back.
Oh, no.
So taking HRT is not like taking an antibiotic where you go, oh, I've taken it now, everything's going to be fixed, I can come off it. Hormones are out of your body in hours, okay? So as soon as they're out of your body, the symptoms are going to come back because the symptoms are there because the hormone's not there. So it is, a longer journey. And it's a dance to get right. But to come back to your question of how women can access this, there's the NHS route, there's the private route, but there's also these over-the-counter creams that can be really supportive for some women, but they are much lower doses than you would get on a prescription.
Could you potentially take, because I take utrogestin.
Yeah.
Can't pronounce that.
No, it's horrible.
And could you, because it's natural, the creams are natural as well, bioidentical, you can take that as well as the utrogestin.
When you're working, and I'd always, obviously I can't say how, I would say work with somebody who knows what they're doing to support you. But, it's not unusual for women to take a cream and have a tablet and maybe take some vaginally. If you've got a woman who's really estrogen dominant, so having real flooding, heavy periods, if you get that progesterone right, within 2 cycles, that bleed will be sorted out. That's usually, assuming there's no structural cause there. But, progesterone is amazing if we were just allowed to properly administer it to women.
Yeah.
And we are allowed, but it has to go off license and has to be, done in agreement with that.
Okay. And so, so in terms of progesterone and ADHD, so it's kind of believed that progesterone does make a lot of the symptoms worse. Does that?
Yeah, so this is really interesting to me with what I've learned more recently about progesterone. Kind of blows out of the water the theories around this. So I've always been of the understanding from the very little information evidence that we have that second half of the cycle is thought to be, progesterone's dampening. It's coming in, we've had this estrogen high, progesterone comes in, it's like, you've rained on my parade. But I don't actually feel that's correct anymore. And I used to teach this. This is practitioners. If we are invested in learning all the time, we have to keep up to date with and deepen our knowledge and understanding so we can help women. And I don't personally believe that's what's happening. I think some of that experience is the estrogen withdrawal, and that stops sensitizing all of our neurotransmitters and we really kind of go, oh my gosh, that's not there. But also I think it's estrogen dominance in some women. The progesterone isn't sufficient for the amount of estrogen, for example, that woman's producing. Because we see such a shift in so many women once that progesterone is right and balancing mood. So I think there's a lot to learn, you know, but we do know progesterone doesn't make medication work so well. We do know that.
I definitely feel the difference. So I'm on ADHD medication and it's quite a big difference.
Yeah.
And I'm very, very low moods that week before.
Yeah.
And I'm on the regular dose of futrogestin.
Yeah.
But I'm taking it vaginally because I reacted. But I might try it orally again. And see how it goes after a while. Does it also take a while for your body to get used to?
So this is a really good question. So we always say, like, you know, unless you're working on a specific protocol with us, the general rule would be give it 3 months, you know, and see how you're feeling. But I have this personal theory, which is not based on any science at all, that neurodivergent women have double the number of receptors to everything in their body, that, you know, we're just more sensitive to everything. And I actually think HRT, you can feel the effects very quickly in some women. I mean, I certainly know the first time I took progesterone, I woke up in the morning, looked at my husband and went, is this what normal people feel like? I was like, I feel so calm. What was I was like, okay. So it can be very quick, but you know, for things when we're looking at increasing your capacity, you're not going to see that overnight. You know, you need to look back and track your symptoms. So I'd always say start taking, before you take HRT, track your symptoms, see where you are in 3 months, because we tend to forget how shit we felt. Yeah. And we kind of go, oh, there's something else comes up. So we need to have that as a recognition of our progress. But it can happen very quickly. But actually, to see how it's really embedding, you'd be looking at several months.
Okay. And progesterone, so the main thing that they always talk about is the progesterone for the lining of the womb. And then you mentioned what other things are related to?
Oh, so many other things. Yeah. You know, your mood, first of all. But it supports bone growth. You know, estrogen has always had the spotlight. And it does play a role with bone growth, estrogen, but so does progesterone. Yeah. You know, protecting our nerve health, protecting our breast health. There is this misconception. And I've had 2 clients this week who've spoken to GPs and been told, we're not going to increase your progesterone because it causes breast cancer. This is factually incorrect. They're talking about synthetic progestins. Yeah. Body identical progesterone protects your breast health. You know, we know the link with breast cancer has been with synthetic progestins and estrogens. Yes. It's not progesterones, but because of this communication issue around saying it's progesterone, we're giving out this false information and creating confusion and risk and concern and anxiety about something that's not true.
Yeah. And the other thing I wanted to just mention now was it's only the last few years where we are seeing more and more information and people are talking more about perimenopause. And I realized that the generation, especially our parents' generation, likely didn't take HRT at all because of one study. Yeah. What do you know about that study?
So this was the Women's Health Initiative back in 2002, and it was a statistically insignificant number that would normally be ignored in a research study. But the media got hold of it and created carnage around it. But the data that was showing this potential link, it didn't evidence
what was the link?
With breast cancer and HRT, was synthetic progestins and estrogens. And this went into the media, and it was all HRT causes breast cancer. It has been proven over and over and over again that body identical HRT does not cause cancer. It doesn't. If you keep taking loads of estrogen, you are going to increase your risk of endometrial cancer if that is not properly monitored and supported with progesterone. But that's because it's too much estrogen. If you had a body that didn't ovulate and, you know, were estrogenic, there's probably a greater risk there with that. It's the estrogen. So we need to make sure prescribers properly understand the ratios and amounts and that women are using it properly. So that initiative that research has been largely very discredited, and there have been multiple research studies since that have disproven it. In fact, in June last year, I think it was, or the year before, the Cancer Journal, they undertook a literature review of all of the studies, and I think it was the lead on breast cancer oncologist said there is no link. There is no link here. The only thing there is if you are on HRT and there is already a tumour there, it will make it bigger so you can find it and get it removed. And the outcomes for women on HRT are much better for women than who are not.
Huh.
That's the truth.
Yes.
Not the myth and the chaos and the mess.
Because the amount of women I've talked to since like being now, I don't know what, but like for me, it's like as soon as I got all this information, I was like, I need to tell everyone.
Tell everybody.
Everyone
That's what I'm like. That's why I was on Instagram. Like, everyone needs to know this.
Come on, people. But there's so many women that I talk to that are like in their 50s and like, no, I don't want to go on it. I decided not to go on it because it's too many risks. I'm like, those risks aren't true.
They're not.
But they are really scared.
Yeah, of course they
trying.
are. Why would you not be? Women would, and that all that has done is made women suffer. That's all it's done. Women have suffered. And actually, if you look at the data, you can see where like thousands and thousands and thousands of women came off of HRT, and then you see all the health risks go up. So the HRT comes down and things like cardiovascular disease significantly increases. You see this direct link where women came off.
Done that graph?
It exists. It exists.
That
I've seen it.
Mental.
Yeah, that is the impact it had on women's health.
Because you think about like there's loads of stuff about how more and more women are on antidepressants. Like, I think
they haven't got any progesterone because everyone's so stressed out. And this is, I think, an important link when you're looking at what I would call our foremothers. So our mother's generation, our grandmothers, they're all looking and going, we just got on with menopause. What's this big deal about, right? And they're right, because we are the most chronically stressed generation of women that we know to have existed in the modern world, okay? We were sold this myth that we could have the education, the career, be amazing mothers, gorgeous wives, run the house, do all the things, right? And because of our 24/7 pinging and dinging lifestyle, our adrenals are exhausted. Okay, so what should happen in menopause is that as the ovaries naturally and normally slow down their production of estrogen and progesterone, they kind of knock on the door of the adrenals and say, right, you need to take over now. It will never be the levels the ovaries produces, but it will be enough to replenish the woman and keep her feeling well. Now, for our generation, our adrenals are fucked, okay? They are not working in the way that we need them to. So as the adrenals are saying, the ovaries are saying, can you take over? The adrenals like, forget about it. No, I can barely stay on top of my cortisol production. In fact, any progesterone you are producing, I'm going to nick and turn into cortisol, because cortisol is a queen bee hormone that will always be prioritized by the body because you need it to stay alive. And it will steal progesterone. It's a very simplified version. I've actually put it on my Instagram today. You will see the process, the chemical process, if you're very nerdy. But that's what it does. So our adrenals are exhausted, and there's a strong argument to say it's not menopause, it's an adrenopause. It's adrenal issues in women, which is why women in the Western world have the worst perimenopausal symptoms, because the adrenals are not producing the progesterone and estrogen that we need to keep us going. So they're right. Our foremothers are right in going, what's all this about? Yeah,
because I also thought there must be some kind of connection also with the fact that a lot of our mothers didn't work and they were at home. So it's not that they didn't experience it, but also they were kind of alone, and no one, you couldn't hear them. The internet,
you have a look, right? We look back 50 years of the differences. Most parents have their children attached to them like limpets, right? Because we're too scared to let them go out and play because we know too much about, someone in a white van coming down the road and taking them. Children, there's a big... Motherhood itself, if you are a mother, is a very different journey to what it was 50, 40 years ago. Children went out and played and they weren't really seen. Women weren't working in the same way that women are working now. When I try and compare my mother's experience of having a child in school to mine, they are worlds apart. I might have brought home one tatty piece of paper every 3 months. She needed to sign and stick a check in my bag. We've got WhatsApp groups. We've got emails. We've got... You need to do this, you need to do this, you need to do this. Just managing a school, I need a PA, you know? And it's like, that's the level of stress everywhere we look.
Yeah.
No one can get a hold of you unless they rang your house or wrote you a letter. How many messages, how many people need to get a hold of you within an hour? Just the time we've taken to do this podcast. How many messages are you going to have on your phone that is expecting that quick response? We're exhausted.
So exhausted.
Our adrenals are tired and they've had enough. And then you want them to take over producing more. Forget about it. I'm not doing it.
I totally get it.
Yeah.
In fact, that was one of my biggest tells something was really wrong. After I got sold my company, I got divorced.
Yeah.
I got divorced, then obviously finished working. I had an earnout, and then I had a nanny for the kids while I was working, and then she left. As I started having to do a lot more of those like everyday activities, and then going into perimenopause, I realize now, honestly, driving my daughter to school had me in such a stress. I had to park up in the car park and cry for 20 minutes afterwards.
Yeah.
Every day.
Yeah.
And then suddenly I was like, surely this is not normal.
Yeah.
What's happened to me?
Yeah.
Who am I?
Yeah. And what you'll get, so let's put you on an antidepressant.
Yes, that's exactly what happened.
Give me some estrogen and progesterone.
That's exactly
there.
what happened.
Yeah.
They didn't just put me on antidepressants. They gave me benzos.
Yeah.
For sleeping.
Yeah.
I was a complete mess, and it just got kind of worse and worse. But weirdly, and this is, I call it like my blessing, but this was when things got really scary, is like in 2022, my memory started getting so bad.
Yeah.
But because I was so stressed out, it was almost a relief because I couldn't remember what I was stressed out about.
It's fine. I don't really know what's happening anywhere. It's all okay.
It's like Dory from Nemo.
And when I hear you saying this about being put on a benzo, knowing the risks, knowing the side effects, progesterone for many women has exactly the same effect without the risk, without the side effects. Why would we not be looking potentially at prescribing progesterone for sleep issues in men and women?
Yeah. Can men take a progesterone?
Yeah.
I did not know that.
Yeah, I mean, it's not something that is my expertise, I know of, but certainly Carol Peterson speaks and works with this. Like, men need progesterone too, because the same children, the same physiological process of that cortisol and progesterone happens in men's bodies too, and children's bodies. In fact, there's 2 studies specifically around progesterone and ADHD. One is around, and I haven't seen these studies, so don't quote me on this, but when I've spoken to the international leads on this, I've been informed of them, but I haven't found them yet because I haven't looked. But that women who have lower levels of progesterone when they're pregnant have a link with having ADHD children. So I would say women who are more stressed when they're pregnant are likely to have lower levels of progesterone because of that cortisol stealing it, which, as I say, is a very simple way of saying it, but that makes it easy to understand what's happening. And also ADHD children have lower levels of the allopregnenolone, which is the metabolite of progesterone that has the calming effect on the nervous system. So there's this link. And I'm like, tell me more. I need to know more.
This is so fascinating. I did a course, a 6-week course about women and ADHD when I first got diagnosed, because I was like, I need information. Yeah. And one of the things the professor, so it was Professor Annika Tomlinson, I think, from Oxford, that did this. And one of the things she had on one of the slides was about that women with ADHD are 10 times more likely to have postnatal depression.
Oh, yeah.
Wow.
So you think within any woman with postnatal depression, we are much greater risk of it. We're much greater risk, 10 times more likely to have PMDD, much harder perimenopause, much more likely to have postnatal depression. Within 2 or 3 days, the hormones drop by thousands of times. So within 3 days, we go, all those lovely hormones that have helped us to manage our traits and our mood, then we don't sleep. The body's been through a trauma of ejecting an entire human being from it. You're exhausted. You haven't got the tribe of women that we should have if we were meant to be living the way we're meant to. And then we go, oh, she's got a bit of the blues. Yeah, she's funny that. Yeah. She has, What actually, if we were supporting women saying, right, we know you're neurodiverse, or actually any woman, we know, the way that we're going to support you if you start to feel this way is to give you some hormones. Yeah. We're going to give you some progesterone and estrogen to just help to ease that transition through in this crazy world that we live in, because we're not birthing and earthing babies in the way that we're meant to.
And I really look back on my own. So I had my first daughter at 26 and I had really, really bad postnatal depression. It was so bad. It was so dark. And I now feel really, really kind of sad for that version of me that I didn't know any of this, and that just assumed it was me, and that it was trauma or the past.
That's
or
what we do
whatever.
as women, right? Oh, it's
Yeah.
something with me. Oh, it's my childhood trauma. It's because
Yeah.
this happened because I haven't done something properly.
Yeah.
It's where we go to.
And now I realize that also coming into perimenopause, I got the same thing. And I don't think this is obviously not at all just related to women with ADHD, but the thing I wasn't prepared for was just how bad you feel and how much anxiety you feel.
Yeah.
Like one of my cousins, I have a lot of cousins, like 34. I'm from
Wow.
northern Norway. And one of my cousins, she committed suicide a couple of years ago. She was in her late 40s. And I can't stop thinking about it. I can't stop thinking about whether it was menopause related. Because they were like, she didn't really struggle with this before. And I think that's a really big thing that people should be aware of. If you suddenly if you've had depression or had issues before and they suddenly get a lot worse in your 40s or it reoccurs or you never had it, the likelihood that it's hormone related.
Honestly, this kind of goes back, I guess, to where we started at the beginning about this patriarchal model of medicine, where had women been involved very early on in the development of medicine, we would have a very different model to approaching women's mental health. My personal and professional view is that deal with a woman's hormones and see what you're left with, you know? And that is the challenge for the prescriber, right? Even if they're well informed about hormones, properly informed about hormones and really understand them, that is there a hormonal issue or is there actually a mental health? Because there is a place for SSRIs. There is a place for some of these medications, but I don't believe they should be handed out like Smarties. This is an issue for the number of people that are on them. Something is going wrong. And for me, the model and understanding that I have around the role, how depleted hormones are in women, I'm not surprised that there's this massive issue in mental health. And no one's saying, let's try a bit of progesterone on you for a couple of months and see where you are. Let's get you sleeping again through the progesterone. Yeah. Let's get your nervous system calmed down from the progesterone and let's see where you are.
Yeah.
And then maybe, there might be a need for some of these other medications. Or actually, no, I do think this is the right route to get you on an SSRI. But instead we just go,
immediately.
Yeah. And it's like, if we had properly equipped prescribers to truly understand the multiple roles hormones play significantly on mental health, we wouldn't be having that approach.
Exactly.
But that's not the case.
And for me, it's just mind-boggling. Just looking through my own kind of record for the last 6 years, and mine was at least 15 grand. Those are the ones that I can quite confidently put a charge to.
Yeah.
And obviously I've just looked it up online or whatever.
Yeah.
But if that is one person on 15 grand unnecessary procedures, how much is this costing the NHS?
Exactly.
And why would they not use some money to invest in doing the research and giving some more education to the GP so that they can try the routes first?
And this is the big question. I have my personal views on that, but I feel this is the question. We know this stuff. The work of Dr. Katarina Dalton, who was treating PMDD with these mega doses of progesterone 75 years ago. 75 years we've known this for. Why is it not frontline practice?
Yeah.
Why is this not the standard approach? There's something else going on as to why I truly believe we live in a world that doesn't benefit from women being well financially.
Yeah.
There's a huge cost on society of women functioning at 50% at best. And that doesn't matter because there's so much money to be made from women being dependent on medication.
Yeah, honestly, I agree actually. So one of the hang on, my thought. Okay, menopause.
Menopause and ADHD.
Menopause.
Here's podcast. Start talking about squirrels and washing machines.
Exactly. In fact, that's one of the things I used to say, that I was a squirrel. I'm like, oh, squirrel. That part of Up the movie when the dog just goes squirrel.
Yeah.
And that really is the kind of like when your brain just goes. In fact, one of the most fascinating things about this journey of understanding the perimenopause is just how many symptoms and just how many like weird things. Now talking very openly to my friends the same age that are also in perimenopause, we laugh our heads off at the most random things we do and say or things like, but it's scary. But
Yeah.
you also have to kind of realize that that you have to laugh at some point.
You do. And having a sisterhood around you of just going, I'm so sorry. I thought I was meeting you tonight and not tomorrow. So we're in the wrong place and I can't see you. And they're going, don't worry about it. It's fine. You know, that kind of acceptance and permission within circles of women. So much healing happens in sisterhood, in circles, in having good women around you, where there aren't these sort of, you know, witch wounds and sisterhood wounds where, you know, we've been taught to not trust each other. If you have those safe people around you, I think that's the best medicine.
Yeah. For sure. And also just knowing someone else, like talking about it is so important, because if once you start talking about it and they're like, oh yeah, me too.
Yeah.
And that connection of feeling like someone else knows how you feel is great. And one of the things with ADHD that I find fascinating, that I now understand, is how we are thinking, how our inner monologue is working is kind of really damaging. But finding out that I have ADHD really helped me understand that the way I think about this is how my brain operates, and it's not me as an individual. I am not like wrong. How did you feel when you got your diagnosis, and how?
Oh my God. It was the most validating experience of my life. I was like, oh, there's nothing wrong with me. You know, because I know there's multiple theories around what ADHD is. The one that aligns and feels right to me, doesn't need to feel right to anyone else, is that there have always been people with our kinds of brains, right? And I think we were the people that were pivotal to human evolution. We're out of the box thinkers. We're risk takers. Our brains are constantly risk assessing. You know, we're sensory to everything, which was amazing when we lived in the woods. We had a stick break 2 miles away. We would have known if we'd smell a food and go, no, it's rotten. We would have found ways over, you know, no is not an option to us. If someone says you can't do that, it's like, yeah, I can. That will find a way. You know, that these are what humanity needed in order to evolve, right?
Yeah.
Now, the problem is we're in a world that is so hyper-stimulated. Our ADHD is on steroids, okay? And that has dysregulated our nervous system, has caused inflammation in the body, because it's like, oh, our cortisol. You take yourself back to being an undiagnosed little girl, probably with rejection sensitivity dysphoria. You're 5 years old, you're sat there and all you're thinking is, who's going to play with me at lunchtime? Have I done something wrong? What's expected of me? Trying to hold down your traits. The hyperness is internalized. You know, we're not allowed, boys will be boys, jumping around and playing. Little girls aren't given that privilege. You know, we have to learn to mask. Our nervous system is dysregulated from the start. So, you know, for me, there was something really empowering about going, there's nothing wrong with me.
Yeah.
You know, I just don't think like you. And thank God, because it must be really boring.
Exactly.
You know, I really look at that in that way. Don't get me wrong. There are challenges, you know. I'm very sweary. It's always like a bit like a tick for me and like a stim for me. It comes out, but people judge my level of intellect based on the language that I use, you know, or, you know, there's lots of different things that are my ADHD type traits that women experience a lot of, that we get judged. They get judged as character flaws.
Yeah.
And that's really damaging to self-esteem. And I can look back through my life and go, that's why, that's where that came from. And it's been such a healing journey for me. And I was very fortunate that I didn't go through the grief that lots of women do experience of like, oh my gosh, how different could life have been? Because all of my life I've kind of done what I wanted to do, really. Yeah. And but I look back and go, God, I only got to that position. That was the stroke of luck. That, you know, I never was like, it's because I was really good at what I do.
Yeah.
And if you work with an ADHD person who is passionate about what they do, you will get the best service, because there will be no stone unturned around knowing that knowledge, and they're not afraid, you know, they will be tenacious with it. If I work with a client, I'm like, what is this? I have to find out until I know, you know, and that works really well. So if you do something you're passionate about and you enjoy, you're going to be amazing at it.
Yeah.
You know, but we're funneled into, I made the mistake, for example, with my A-levels. I was like, oh, they sound like easy ones. Oh, I hated them. They were so boring. It was so painful. And I did awfully in them, even though I was very academic. And they're like, why have you done so badly? I don't know. Well, now I know it's my ADHD. If I'd done the ones I was interested in, I would have like been amazing at them.
Oh my God. Like it's so fascinating though. Like I can absorb like vast amount of information if I'm interested, but I cannot read a paragraph if it's something that I'm not like, and I can't remember any of it.
Oh my gosh!
Like the remembering thing is like sorry, interest has not engaged.
It's like to explain what it is like. You know, people are like, what's it like to be in your brain? I'm like, it's a lot. You know, and if someone, you know, as you can probably tell, sorry anyone listening to this, one of my toxic traits is I speak at 100 miles an hour. That's just how I speak. But if someone starts talking like this, inside my head is someone going, run! I have to leave I can't, my nervous system gets so dysregulated when someone speaks slowly to me. I'm like, I'm really sorry, I have to leave. I can't do this. I'll look for any excuse to get out. So there's so many things that I now offer myself compassion and kindness about. You know, I've been told my whole life, you need to slow down, Adele. Yeah. Don't need to slow down. You all need to speed up.
Yes.
You know? And
get there faster.
It's like, why am I the problem? You know, so it's really starting to, and it's an unraveling. Yeah. It's a constant unraveling. I feel like that's why I do that. Yeah. You know, if my husband starts talking to me about his work, I'm like, no, we're not doing this. I'm just going to phase out. I'm not interested. I hope you're okay and you're happy, but don't tell me detail by detail. I won't retain it.
Oh my God. I so recognize myself in that. Yeah. Apparently my ex-husband used to say that the thing I used to say to him the most was, can you get there faster?
Can we just speed this up, please?
Come on, tell me fast. I'm just
because we've already
hurts.
Yeah, we've gone to we know the end of this conversation, and we've replied, and then we know what they're going to reply, and they're still on the same sentence. Then it's like, oh gosh, I need to get out of this situation. Yeah. And what I love about being with ADHDers is how we're having two different conversations, talking over each other, listening, processing, talking through it. My best friend and I, her husband's like, I can't be around you. Yeah, and it's too much. He can't get into the conversation.
Yeah, but that's the thing is like I think this is I'm now kind of learning to really love my brain like this because it is like the northern lights. It's pink and then it goes green and it moves again.
Yeah, and who knows what's going to come out next?
Yeah. I'm like, I have no idea. Like I had a podcast, like a business podcast with a guy the other day, and he was telling me about this thing that I'd said to him when I first met him on this panel, and he's like, you said this thing to me and I've repeated it to everyone, and I was like, no fucking idea what I said.
Did I?
Did I say that? Excellent. But it's like it is almost like a way of like speaking while you're thinking.
Yeah. And it's like verbal processing.
Yeah.
Yeah.
And it actually I really enjoy it. Now I know that it's not, you know, like because just knowing that I am not wrong or like it's not necessarily a bad thing, allows you to just let yourself go. And then like, instead of feeling like I'm turning my volume down, I'm like,
make it louder. And this is the beauty of being diagnosed in perimenopause, right? Yes, we can look back and go, oh my gosh, I wish I'd known this decades ago, but you can't change that. No. What you can say is, great, I'm in perimenopause now. My BS filter is off.
Oh my God.
And this is me. Yeah. And there's great power in a woman who refuses to abandon who she is to be accepted by others. And when you can find your tribe who accept you fully as you are, you don't need to mask anymore. Yeah. And in perimenopause, we haven't got the hormones to make us mask. Yeah. So here we are. Like us and lump us. This is it. And when you're stood in your truth like that, that is a really powerful place to be as a woman. Yeah. Of like, I'm stripped back, you know, we have to work on that RSD because we all want to be liked, you know. Yeah. RSD for me is the curse of an ADHD woman. So the rejection sensitivity dysphoria. That's the worst bit, you know, that like, I've done something wrong, which is so, you know, that's why before I share anything publicly, I know what I'm talking about. I am not going to put myself in a vulnerable position unless I'm sharing something that I have researched the facts of till way too long into the morning and spoken to the lead experts and know what I'm talking about because of RSD. So that's a great fuel for it. But when it kicks in, it's so dysregulating.
I remember the first time like I really felt that, and it was a friend, and that gives you like, it's weird. It kind of, I feel like that's a trauma trigger for me. It was a friend that sat me down and said, Lisa, it's really annoying. And she properly sat me down. She's like, it's really annoying when you interrupt me, and you do that quite often, and it's something you need to look at. And it was totally fair because I did for her. But the pain.
It's a visceral reaction.
Oh my God, I just could feel my throat closing now.
Yeah.
Because that was the first time. And from then on, I was like, I am too much.
Yeah. And we're told we're too much. It's unpicking the too much story. You know, whereas in perimenopause, it's like, be too much. The world needs women to be empowered and too much to change the mess that it is, you know. Yeah. But that RSD reaction is like billion pins going off in the body like a bomb. It's visceral. Your throat. I remember so many times as a little girl just having to smile when all my throat felt like it was going to explode with wanting to cry. It was painful.
Yeah, it's so actually visceral. Like I said, it's
very
really
real.
awful. And it like. I think I learned to also mask it really well later on, and pretend like I then became like the funny one.
Yeah.
I would always bounce back with a joke. I even did this is how the menopause went for me. Left my job, had divorce, did the Erna, had a big crash, started doing stand-up comedy.
Brilliant. That's such an ADHD journey. I can't tell you.
For 2 years, I was supposed to do a neuroscience master's, and instead I went out and did for 2 years. What the fuck? My friends are like, "How did that happen?" I'm like, "I know."
It's welcome to my brain.
But
Here
also,
we are.
it was all I could cope with. I was like, and because I felt so triggered, like I really felt like now I can see that it was that little girl in me that always wanted to tell the jokes when I felt really dysregulated. I just had like
steroids.
2 years of just fuck it, I'll tell some jokes now.
Yeah.
And then when I started HRT, it literally was like as soon as I started HRT, I'm like, I do not feel the need.
I don't do that anymore. Excellent. Moving on. Next exciting topic I can hyper focus on.
Yeah, exactly. Oh, yeah, no. Oh, it's been so amazing to have you on this podcast. I would love to have you on again when I do the one about ADHD.
Yeah.
I'm going to give everyone like the information and stuff about your website and stuff. Please follow Adele on Instagram. I'll leave all the details in the show notes. Okay. But thank you so much. And thank you for doing all this great work, helping women figure their hormones out, because it's about time.
Yeah. Thank you so much for having me. I could talk to you all day.
Yes. We should just do that. We should just do a day of just like, we'll just chat. Hello again. Thank you so much for listening. I hope you enjoy that. I would really love to hear any feedback you might have or comments, or maybe you have a suggestion to a topic we should cover. You can get my email on the website or send me a message on Instagram. Please do follow the podcast and maybe even leave us a 5-star review. It really helps to get the message out. See you next week.
Questions echo in my mind, searching answers can't seem